Demystifying marketing terms in plastic surgery. We're going to break it down full throttle next. Hey, Doc audience. So marketing terms in plastic surgery, Rod. Oh my God, like we've not seen this before, but
yes,
there's a lot of terms out there that we're going to talk about, but things like this is a scarless breast augmentation or scarless tummy tuck. It's a misnomer because it's just a marketing term. It doesn't really exist in reality.
I know. I mean, scarless surgery, I mean, how can that be possible? It's an oxymoron.
Right.
Surgery means cutting something. Yeah. I mean, and like the ponytail, foxtail lift, and all these trademark names, the vertical lift, and then the deep plane lift, and all these things are really misnomers, and they can be misleading because they're not new, but they're certainly been amplified by social media. And I think the biggest disservice it does is it just confuses the public. And people come in, there's not a day patient comes in and says, well, do you do the deep plane? I said, yeah, I've been doing a deeper plane facelift for a couple of decades or longer, but of course people don't know what that even means.
Yeah, and it's harmful to people that don't have a huge knowledge base because they have no idea.
Right.
But Matt, like what do you think just in general? I've got a list of things we'll go through, but what do you think about these kind of terms and their harm to patient education, properly being able to communicate with your patients, making it more difficult? What are your thoughts?
I mean, it actually requires more education with the patient, and that's really what we're here for. You have patients come in and they say, yeah, I was interested in the scarless facelift. And the fact of the matter is that anytime you cut the skin, there's going to be a scar. And you just have to educate the patient that, we can place the scars in inconspicuous locations, but there's going to be a scar there. So as long as, patients are informed of those things, and I think that, you just have to make sure that they understand that it's a marketing term and make them aware of that, and then let them know what the options are specifically for them and what they can expect. Set realistic expectations with the patient.
Yeah, it's a rotating reel of these things that go on. But used to be, I haven't heard it that much recently, but scarless breast augmentation. And it was when people talking about transaxillary breast augmentation because they say, oh well, there's no scar in the breast. Well, that's the most ridiculous thing I've heard. If there's still a scar, it's in the armpit, and oh, by the way, it's not the most inconspicuous scar.
Right.
And for at least 6 months, you can't wear a sleeveless shirt without being able to see it, obviously, and there's other things too. So it's just a misnomer, but that's just an example.
Yeah.
How it's a misleading term, which is like we want to stay away from misleading patients, and we want patients to really understand exactly what
they make it seem that transax incision is much better because it's scarless, when in actuality, for a variety of reasons, it's much worse to do it that way.
It's just illicit marketing to try and really deceive the patient on say, hey, I got you, and then of course after surgery, it's a real problem.
Yeah. Expert plastic surgeon, Dr. Ed Gronet. Ed, what do you think about this topic? It's actually a very rampant issue within plastic surgery, and it's probably gotten worse since we were in the era of social media and just easy access to information.
Yeah, I could do scarless surgery in 2 ways. I don't know about you guys, but 1, not operate. Number 2, get very creative with our photographs. My favorite example is an arm lift, a scarless arm lift. There's actually very much a scar there, but a lot of these before and afters, they're just getting creative with the way they're taking the photograph. If we're using a posterior, meaning on the back of the arm scar, and having our patient wave to the camera, sure, there's no scar until they put their arm down. So these are just, like the guys are saying, marketing tricks. The only way to excise tissue and remove it is to add a scar. The only way to get into a nose is to add a scar. Like we're saying with a transaxillary, meaning through the armpit, or a scarless rhinoplasty, there's still a scar, it's just somewhere else. So scarless, maybe we're really just trying to say we're getting better at hiding scars or hiding them from our patients through creative photography.
Yeah. So Arredondo, what say you about this?
Yeah, we have a large social media presence, and so we try to be as much of the expert as we can. We have around 800,000 followers last check, and so a lot of the videos we put out are really trying to be educational, take these TikTok trends and these, Instagram reels that people are catching on to, and then say, okay, let's really break it down and explain exactly what this means. Show them what we really do on a day-to-day basis, what our real patients look like, no filters, no creative photos or angles, so that way they can see the reality of what it is. Today, anybody with 5,000 followers is automatically an expert on whatever they're posting about, and so we try to counter that as best we can, and just be a really reliable source for our patients.
Yeah, I think that's a good point. Well, let's just go through this list. We got others just to discuss. So, one is, there's a well-known breast implant company that keeps talking about their Blue Seal. Well, Blue Seal is actually something that's been in all breast implants since 1986. There's nothing new. And the part that I think that misrepresents is it's described as like it's something that they have that nobody else has. And maybe they dyed their inner layer blue, but it's the same thing. It's to decrease gel bleed in the breast implant.
Right.
How about ultrasonic rhinoplasty, Rod? Like, what is that?
Well, it's the use of instruments like piezo instruments actually to really mold the bones, and you can mold or fracture the bones, with this technology, and it's ultrasonic type. And you can. It's kind of a half truth, but. It's like preservation rhinoplasty. Preservation. Yeah. Well, it's truly a misnomer because it's the old let down, push down. It's a good technique in selected patients, but you're doing everything but preserving a small little piece up here in the dorsum. So it's a very challenging procedure if done well.
Ed, that they used to talk about. Again, this is one I haven't heard recently, but they kind of rotate, so I expect it to come back in the fold anytime now. But laser mastopexy, and it was where somebody would just use a laser to deepithelialize the skin, but it was a laser mastopexy, like it was some more precise way to do a mastopexy.
Yeah, I wonder, since you guys have been in practice and educating so many people, how many, what's the cycle? How many years does it take in between hot terms to come out with these sort of things?
5 to 10 years. Usually they go from the zealot phase to the pragmatic phase, and it just keeps repeating itself. Recycling, and if you don't know the literature, you're just going to repeat it.
I think that's well said. And Matt, we're going to give you the last word here. So, what do you think? What's the take-home message for everybody?
I think the take-home message is that have a consultation with a board-certified plastic surgeon, and if there are some terms that you don't understand or things don't quite make sense, or you don't understand how, a breast lift or a facelift could be scarless or what preservation means, then, maybe consider having another consultation with another board-certified plastic surgeon and, compare, what you have to hear at each of the consultations and do your research and make sure you understand everything. The surgeon has excellent results, and just make sure you're making an educated decision.
All right, great stuff. Tell us what you think. Do you see a lot of misleading marketing terms in plastic surgery? Is it confusing you? Definitely leave some comments, and we'll readdress those in future episodes. Give us a little love. Give us a like, maybe. You can subscribe to the channel, and we'll see you on the next episode of Hey Doc.